Good afternoon, dear patients. Today we are going to discuss a clinical case as shown in the picture. This is a growth in the anal area. So the patient came to the clinic because he noticed and felt, while washing himself, some growths in the anal area that he hadn't noticed before. Since he uses public restrooms and having seen various publications on the internet, he became very frightened that these might be genital warts in the anal area, even though he does not engage in anal sex at all. And in fact, during the examination, 2 growths on a stalk were indeed visible, which you can see and which could very well have been genital warts. It was decided to take tests, specifically tests for the human papillomavirus. We tested for all 21 types, taking samples both from the surface and from the anal area, as well as from the urethra. All the tests came back negative. Well, basically, we expected this because, as I mentioned before, the patient does not engage in anal sex, so this area is not involved for him. So, in principle, a presumptive diagnosis of soft fibromas in the anal area was made. This is a benign growth that really resembles genital warts, but it is, let's say, essentially a formation that is more related to the gradual degeneration of the skin and its protrusion. However, in appearance, it is very similar to genital warts. You can watch a separate video on our channel for a more detailed explanation of what soft fibromas are. So accordingly, the patient still insisted, of course, on having them removed. We removed these soft fibromas using the radio wave method with anesthesia and performed a histological examination. The diagnosis of soft fibromas in the anal area was indeed confirmed, which once again ruled out such a diagnosis as genital warts and any association with the human papillomavirus. Therefore, in the genital area and the anal region, other types of growths can indeed occur. It's not always just about genital warts. In general, this should be determined by a doctor and the appropriate tests, and by no means by the so-called navel eye of the patient or even the doctor.